Gentlemen, welcome to the Be the Man podcast. I'm your host, Greg Denning. I'm the creator and coach of the Be the Man Masterclass and Tribe. Today, my guest is my good friend, Tom Ludlo. We, as family friends, we've gone and traveled and gone on vacation together up to Tahoe. We actually trekked up to the base camp of Everest together. As couples, we went and we chartered a private yacht and sailed around the Galapagos together last year. Just awesome experiences with a good family, and he's a great man. And Tom is a very successful dentist in California, but there were some elements in his career that led him to become a sleep expert. And in this episode, we really dive into what's happening in the mouth, and then how that's affecting sleep, and then how the cascade effect of sleep and how it's affecting our lives. I geek out about this stuff, and I love studying sleep and what's happening. And as you're gonna find out as you listen to this, you'll be blown away by the specific examples and stories he gives about how the quality of our sleep, well, what's happening in our mouths, right, and how things are shifting and changing in an unhealthy way, and our breathing, and then the way we breathe and the way we sleep is affecting every other part of life, especially parts you don't think would be related. Anything from ADHD and behavior to symptoms and systems in the body is not operating like they should. Anything from menstrual cycle in our wives or daughters to losing weight, exercising, fitness, brain function, all of it is all being affected by the quality of our breathing and our sleeping. This stuff is amazing. And we dive into the science behind it and the effects and how we can all sleep better. And I'll just tease this one in here. You actually poor sleep and sleep apnea will take more years off your life than even, say, smoking, right? Which just boggles my mind. And there's tons of research and science behind this. Great stuff. So dive in here and let's learn how we can all be more optimized in our mouths, in our breathing, and in our sleeping. Enjoy. All right, fellas. So Tom and his family were traveling back from South Africa last week, and they had a layover in Atlanta. So they came over to the house, and we got into this conversation again. And so I was like, man, we have got to get this recorded to share. This is cool stuff, because I like you have been just kind of geeking out about human performance and these little optimizations, and we're going to dive into this about the ways, like, you think these little things are unrelated, but they're all related. Everything's related. So Tom, we are so excited to have you here, man. Grateful to have you on the show.
Oh, I'm happy to be here, Greg. And it was great spending time with your family, and you guys make the best crepes ever. And your super nachos were fantastic. So
That's awesome.
Love spending time with you guys. It was awesome.
Yeah. Isn't that the best? Like getting together with friends and having good food and good adventures. So just some background too, for listeners, like our families have had adventures all over the place. We've done some cool things and created some cool memories together, and
absolutely
this awesome stuff.
I still can't remember the time we were hiking to Everest Base Camp, and you have your son Parker on your back as we're hiking because he's fatigued, and you're just that was epic. It was really cool.
That was a great one, man. That was a great one. All right, so give us a little bit of background on how you got into. Yeah, because it'll all related, but it seems
it's interesting because I am a general dentist. I went to UCSF dental school and graduated, and I was really fascinated with helping people. And so I found that there was a lot of a subgroup of people that had a hard time getting dental treatment done, and they were these high fear patients. And so I ended up going and doing some extensive training in IV sedation. And so very few of us dentists are trained in putting people to sleep via IV. And while they were asleep, I would take care of their dental needs. And so where this comes along is that I would find people, as I would put people to sleep, and without them even knowing, we'd find that they would have different challenges with their breathing while they're sleeping. So when they would wake up, I would say, you know what, I noticed that you were having some events that you stopped breathing for a short period of time. I really do think that you should go get some help on this. And this was, now mind you, this was a long time ago. And I found that when I shared that with patients and they were talking to their primary care doctors, they'd run into all these blockages.
Oh,
And so I kind of got a little frustrated and and so I decided I'd open my own sleep lab. So an overnight sleep lab where we would have certified people that would do these overnight sleep studies to help people out, and then we would connect with um, we have a great sleep doctor that would do the diagnosis so they wouldn't run into these roadblocks. I was just trying to make it easier and and fast forward now that was like 13 years ago. um I've since closed my sleep lab, and I've learned a lot that I've been treating patients with sleep apnea from a dental perspective, and we've had some new advances in the last 5 years that are just, it's been phenomenal. So what I did 13 years ago is different than I'm doing now, and ultimately we're actually now getting to the core element of treating the source of these problems, not just ultimately treating the symptoms. And that's what's super exciting.
yes. And what we'll get into here in a minute is how, well, not only sleep, I think it's becoming more and more kind of common knowledge of like, look, the quality of your sleep is a huge determining factor for so much. But what's interesting is the dental route here, and just how what's going on in your mouth is having a huge effect on what's going on in your body, and sleep and breathing. So it's all this combination of all these little the functions, right? These systems in the body, and how like when one gets off a little, that
Yeah.
can just have this cascade effect on all these other areas of life. And so you're having symptoms in like one area of your life, maybe it's focus or behavior frustration. I mean, and you have some awesome examples I hope you'll share of like, this is just coming up, and like, well, let's trace this back and see if it comes back to even breathing
Yeah.
and quality of your sleep.
Greg, you make such a great point. And I think so often our society, unfortunately, is so targeted at treating symptoms, and we're really quick to give medications for these different challenges. And what I really like is getting to the core element of what's really causing it, going upstream and really find out what the source is. And then once we fix that, we find that the ripple effect of the things that are downstream also improve. um, so one element that so with the things that we do, one thing that I do is, as I work with a lot of children that are struggling at school, ADHD. We heard this a lot. Why are kids having more ADHD and a hard time focusing and concentrating than we ever have? And it's interesting is that when we look back at there have been some studies that have looked at skulls of humans, and we look back at what the skulls were like 400 years ago. We noticed that jaws were big and broad and wide, and consequently the jaws, the upper jaw and the lower jaw, is what forms the airway. That's the collapsible part of the airway. And so as the jaw over time has been getting narrower and smaller, our airways are getting narrower and smaller. And so it's much easier to have those airways blocked. So, and
Okay,
there's,
then
yeah,
this is where I want to start geeking out here, because you're like, okay, well, yeah, so it's a little smaller, a little tighter airway, like it's still working, like I'm breathing, I'm not dying, like what are you talking about? And this is where just the subtle but significant
yeah,
difference, even a slight difference in breathing quality, now starts to, I don't know, I like the idea of the cascade effect into all these other areas, including ADHD.
yes, that's so true. And so what we find, right, is the upper jaw forms the bones that support the nose. And so if the upper jaw is really narrow, or in dental terms, we say a high vaulted palate. In other words, a really narrow mouth. So if we were to compare the jaw, how it should look like a big, if we were to take the jaw and kind of look at it from a bird's eye view, we want to see a big dome. We want to see a big broad arch. But yet we're seeing in more modern jaws, more Gothic arches. So it rounds in the front, but it narrows in the back. And when that occurs, it changes so many different elements. One, it changes our ability to breathe through our nose. All of a sudden, our nose doesn't have the same diameter of pipes, if you will. So we have a septum that runs down and supports our nose, and we have these great filters on the sides of our nose. We call them turbinates. But if that space becomes too narrow, it requires a lot of effort to breathe through our nose. And our body is automatically wired, because we can only go without oxygen, say 3 minutes for the average person. It's wired to then go to plan B, which is the mouth. And what we find is, if we do more mouth breathing, then that ultimately will change the position of the tongue. It changes the facial development and the jaw development, such that we get this downward backward development in the face, and that makes that pipe even narrower. So just from an overall perspective, imagine breathing through a boba straw. It's a lot easier to breathe through a boba straw. Now, if you switch to a coffee straw, the resistance to try to get the same airflow through that little coffee straw is so hard that the body looks for a plan B, and it shifts to the mouth breathing.
Okay, so, and I guess I want to emphasize, you're saying the mouth is plan B, like breathing
Exactly.
here is plan B, that breathing design is primary through the nose.
Yeah, so often the nose is like, in our society, we view it as this hood ornament on our face.
Right. It's just like secondary if I'm chewing on something.
Exactly, right? I mean, it's just like, I got to make sure my nose looks good. And so people have different cosmetic procedures on their nose. However, really the nose function is incredible, right? So let's just talk about some of the basic things the nose does, right? So the nose, it helps to, as you breathe in through your nose, it will warm the air, it filters the air before it goes to the lungs, and it humidifies the air. Now, the turbinates inside the nose cause rather than the air to go straight in, it kind of causes to circulate up, and kind of, as it goes up higher in the top part of the nose, we have this sinus system up there called the paranasal sinuses. So that's a fancy term. Basically, it's a different type of sinuses that we're normally used to. But in that sinus, we produce our own nitric oxide. And nitric oxide is known as a natural blood pressure medication. It's also a sterilizer. So it helps to sterilize the breathing. As we're breathing through our nose, it's antiviral, it's antifungal, it's antibacterial. So here is a scenario where not only are we filtering our air, we're cleaning it, and we're also helping that nitric oxide also helps it to better transmit to our lungs. We have better exchange in our lungs, so we can be much more efficient in our breathing. Now, if we take that away and we breathe through our mouth, here we have unfiltered, dirty air going straight to our lungs. And how do our lungs typically respond to that? With inflammation. And if you really exert yourself when you're exercising and you're breathing through your mouth, and we hear this a lot, people have exercise-induced asthma. It's because we're taking that dirty air, we're shoving it into our lungs, and we get an inflammatory response.
Wow.
And so
Okay.
yeah.
So I love this stuff so much. When I was young, my brother punched me and kind of like broke my nose.
Yeah.
And I had really small nasal airways, right? The passageways. And so I felt like anytime I was trying to breathe through my nose, I had the coffee straw effect, right? And
Yes.
so like my whole life, I'm just mouth breathing
Yeah.
because it was so small. And then after we were out at your house a while ago, you were telling me about, man, you gotta sleep with your mouth closed. And I literally,
Yeah.
I put some tape over my mouth to
Yes.
try to breathe through your nose. And I'm like, I'm gonna suffocate. I'm gonna suffocate during the night here, like, because it was so hard, and my nasal, those passageways were so small, but I went for it anyways, and they actually expanded, and I
Yes.
felt all kinds of improved effects in breathing and all that stuff. But let's dive into like the response there. Let's do
Yes.
sleep. Let's do the change that's happened physiologically, and all the benefits. Like, why does this even matter?
Yeah. So first of all, in the nose, you have two structures, right? You have hard tissue and you have soft tissue. And so, when you had that trauma, the hard tissue, the nose broke, and that made a physical constriction on your airway. And so, but you still have soft tissue that can respond. And so a big part of what can happen when you're doing a lip taping, or even there's different exercises that can be done that you can retrain this soft tissue. There was a doctor in the Ukraine years ago, and he didn't have the benefit of albuterol and these other medications to treat some of these patients that had asthma, but he helped them. He developed these series of exercises that help to use and really to kind of mimic this fight and flight response that we can have to retrain some of the soft tissue in the nose. And so his name was Buteyko. And so you hear these Buteyko breathing techniques. And, you know, to your listeners that want to see if what they can do to improve just without expanding the jaw and without addressing the hard tissues, let's see what you can maximize on the soft tissue. That's a great technique that you can develop. Patrick McEwen is an author, and he's really kind of mastered this, and he even teaches different training. But I think he even has YouTube videos. So you can go on, if you were to Google or look up YouTube videos on Buteyko breathing. That's another great element that you can kind of learn about how to address some of the soft tissue response, so we can breathe better through our nose.
That's awesome.
So yeah, as we are breathing through our mouth, unfortunately, we breathe too much. So we breathe off too much of our own carbon dioxide. And that we need our carbon dioxide because that helps, once again, for better exchange of oxygen in our lungs, in our cells. And so we need to slow down our breathing. We need to breathe better, more through our nose. We need to have good effective breathing. And so it's interesting, even physiologically, if you breathe through your mouth, typically you're more chest breathing. You're using your chest muscles. But if you breathe through your nose, you use your diaphragm to breathe in. And that typically you get more concentrated oxygen when you use your diaphragm. And that's more of the yoga breathing. It's breathing through your nose, not your mouth. Breathing through your mouth actually triggers different stress responses. And if you're having the chest, so once again, we're kind of working against the parasympathetic nervous system. We really want to use that to our advantage. And when we breathe through our chest, we start triggering things that can trigger anxiety and other challenges as well, other inflammatory responses. Yeah,
And
it's
there's
kind of
a direct, it's the parasympathetic, right? It's that system where it's related to chest breathing, right?
So sympathetic, the sympathetic.
Sympathetic. Okay, sympathetic. And so you get this chest breathing, and again, there's all those physiological responses, even in emergency medicine, right? As I'm studying that, I've worked on MS for a while. Like you're watching for those things, but just this chest breathing and mouth breathing, that's for kind of, it's plan B. We're supposed to be going through the nose.
Yeah, we need to filter and more efficiently get that oxygen in, so then our bodies can be more efficient. What happens at nighttime is, let's just step away from during the daytime where we have control of how we breathe. At nighttime, all bets are off, because unless we are physically taping our lips closed, our body's going to go to where's the easiest ways to breathe. And so it's pretty critical, because what happens when we sleep at night, during certain phases of sleep, our muscle tone relaxes. During REM sleep, our body is paralyzed. And during that process of being paralyzed, so we don't act out our dreams, we have a lot of muscles that are relaxing, especially in the throat and pharyngeal areas. So the back of the tongue, the base of the tongue, the throat, those tissues can collapse, and that can stop breathing from the pipe from the nose and the mouth kind of come together, and then they go down to the lungs. And that tongue is what falls back and blocks the airway. And so in those responses, our body then will send off adrenaline, and we'll have this sympathetic nervous system. And what we'll find is we have this fight and flight response all night long. So much inflammation. As a result of this inflammation, we have so many ripples that affect other aspects of our health, right? But the biggest thing is we're not breathing effectively, and it's kicking us out of our normal sleep cycle. So we're not getting the restorative sleep. We're not getting the REM sleep to let our bodies. REM sleep is when our brain is more active during REM sleep than it is when we're awake. So we're doing problem solving, we're locking in short-term memories. It's really a wonderful, we dream during that phase. Deep sleep is when our body can heal itself. So our body has this amazing process of healing, but it can't heal if your heart is beating 120 beats, a minute when you're sleeping. It should
And
be.
it's scared, right? It's slipping into like, oh, I got to survive here. So it's
Yes,
kicking you out of healing.
yes,
There's a cleansing process. It's kicking you out of, well, optimization and learning and uh, learning retention. I mean, there's
exactly.
all. Let's dive a little bit deeper into that, because you and I we talked through examples and stories. Like what's the cost of inefficiencies of air exchange and you know interrupted sleep? Like what's the effect? How does that play out?
So it's interesting with adults, if we have fragmented sleep, whether it's, and let's go back when let's not even talk about breathing, but let's just talk about fragmented sleep. Think about when you had your first baby that was born, and you're getting up frequently all the time, and your sleep, you're not getting into that sleep cycle, and it's being interrupted, and you're just fatigued,
Mhm.
right? So just interrupting your sleep fatigues you and causes problems. And what they did is they did a study with these medical students, and they interrupted their sleep for like, I think it was like 2 days, and they started developing chronic pains after that. And then they let them sleep normally, and the chronic pains went away. So it's interesting to see how this is healthy medical students, that they then just fragmented their sleep, right? So that's one aspect where you see on the healing phase of sleep. Now, what's interesting is now when you look at interruption of your breathing along with the sleep, that's another aspect of it. So with kids don't get tired if their sleep is getting interrupted; they get wired. And when they did a study, and they put in this room with kids that have ADHD, and they put in this room, you know, and ADHD is really a diagnosis based on observed behavior, right?
Mhm.
There's not a blood test for it. There's not a cellular, DNA evaluation. It's purely observation driven. So when they have these trained psychiatrists analyzing who in this room had ADHD and who had obstructive sleep apnea, they couldn't tell the difference. So here's a scenario where, and now we know that over 50% of people that have been diagnosed with this, really it's breathing related. So we need to,
Wow.
and yes, and stop giving medication, but let's start analyzing and really assessing people's breathing before we start jumping into addressing things with medication.
So just to reemphasize this,
Yes,
it's possible that there's a direct connection between breathing inefficiencies, interrupted sleep, and behavior.
absolutely. So, and there's other cases of that as well. So, I'll share an example of a friend of mine. He's 47 years old, very active. He was he's the guy that just energizer bunny, right? He's always working on projects, always doing these different things. He was like a scoutmaster forever, going on these crazy hikes. And what's interesting is on some of these hikes, we noticed that he would snore a little bit. And but he started getting these anxiety attacks. And these anxiety attacks really like would come out of the blue. This is the guy that's totally relaxed. You could have all these crazy scouts running around with knives and with hatchets and with fire, and he's totally calm.
He's good.
Not an anxious guy, but then he's getting these anxiety attacks that were happening. And so we said, well, let's just step back and let's do an assessment and see what your breathing looks like. As it turns out, he had moderate sleep apnea. And so we then started treating his sleep apnea, and we made a mouthpiece that could then hold his airway open, but also start stimulating and growing his jaw bigger so that we could ultimately solve the problem. Now, here we are a year later, and he said that, his anxiety attack started going away within the first 6 weeks of sleeping better. And he hasn't had a major anxiety attack since we started treating his breathing. So this is such an incredible thing because it's such an empowering situation. He was, yeah, he's back to his old self again. And it's just really, so we talk about how sleep and breathing affect behavior. When you have anxiety, that then is a significant, plays a significant role and impact on the things that you choose to do and how you act.
Well,
And
absolutely. This makes so much sense. That's why I love hearing you explain the kind of the functioning biology and science behind it all, because it makes sense. Like the brain operates on oxygen and good sleep and the body functioning normally. And you're saying these subtle things can send us into fight or flight. It can interrupt, well, there's inefficiencies there in just the exchange of oxygen, right? Just drop the oxygen levels in the body. Again, that's another thing I've been studying recently. Just drop those by a couple of points. There's starting to be negative effects all over right away. And then you interrupt sleep on top of that. Now, mental stuff is going to come up, psychological things are going to show up, and physiological and behavior.
it's so true. And let's just talk about what sleep apnea does to our lifespan, right? The average, I mean, a lot of times we compare that with smoking. If somebody smokes cigarettes, a pack a day, typically that takes about 5.5 years off your life. So if somebody has sleep apnea, studies have shown that takes somewhere between 5 to 15 years off your life. So it's 3 times worse than smoking with
What
not
in
breathing.
the world?
Yes. So we have to understand that this is not just a passive thing like, oh, I didn't sleep so well, but this is taking years off of our life.
And the quality of life and cognitive function and just overall
Yeah,
physiological function in the meantime. Well,
that's
and when you
true.
were here, you and I were talking about like a study I'd come across where the inefficiency to lose weight, let's say you're trying to lose weight and get in better shape, if you're not getting into REM sleep, it's actually harder. It's harder to lose weight. There's all kinds
Yes.
of side effects that are just tightly connected here to quality of sleep, which is you're saying is one of the things you've observed is breathing quality.
Yes. And back to your point that our body, if it doesn't sleep well, if we get this shallow level of sleep, we might sleep, 8 hours at night, but we wake up totally exhausted. We know that we're not getting the good quality of sleep. And if we are getting that kind of sleep, our body's going to compensate to get through the day. We do kind of, people tend to describe their activities like they have tunnel vision. They're just trying to just get through the day.
Mhm.
They're not looking for things that will extra things that they can do to enhance their lives. They're just trying to, get from point A to point B, get through that work day and go home and just sleep. And they'll crave 22% more calories to get through the day, and typically using, that being with simple carbohydrates, so that then we then put more weight on, and that more weight on then causes more constriction of our airway because our neck will then collapse as we're trying to breathe at night. And it's just this negative spiral that continues, and then people tend to get diabetes and that inflammatory response. Our own body's insulin can't work as efficiently, so our own pancreas isn't producing enough insulin, so then we need extra medication for that, and we call that type 2 diabetes. So,
Wow.
and then this strains our heart, and and then our body has to compensate and has to work harder to get oxygen to our body, and we have elevated blood pressure. So if we, there's a scenario, a case that one of our patients, she's just a wonderful lady, and she was just, you could just tell she was just struggling in so many different areas of her life. And she had type 2 diabetes, she had elevated blood pressure, she had some challenges with her hormones. She has one son because, and she calls it her miracle son, because her hormone cycle, her monthly menstrual cycle, only would occur once every 3 years, because her body was so off. And she was talking about how even, you know, she was kind of angry and just not her normal self. It didn't feel normal to her. So we ended up, I remember helping her out and we started with creating this mouthpiece, that it's a special type of mouthpiece. It helps to stimulate and grow the jaw bigger as we're treating sleep apnea. Um, it's through a company called Vivos, and full disclosure, I have to say that I am a clinical advocate for Vivos. I'm a doctor that helps other doctors, and I do some training with them. So and so I can't represent Vivos as a company, but I'm just sharing you my experience.
Right.
But we helped this wonderful lady and her son. But we started in November, right around Thanksgiving, and we got her breathing better. Initially, this mouthpiece helps to artificially open your airway, and we started helping her with that. And her doctor was noticing, it looks like your blood pressure is starting to go a little low. Let's get you off of that blood pressure medication, because it seems like that you're going too low here. So she got off of her blood pressure medication, and then she started noticing she was feeling a little lightheaded, and started testing her blood sugar, and noticed that, oh my goodness, her blood sugar was going a little too low. So her doctor then got her off of her type 2 diabetic medications, metformin. And then what's interesting is that and then she started sleeping better and healing, and she started her hormone cycles came back on monthly, and she's like, oh my gosh,
Unbelievable. From once every 3 years.
once every 3 years to monthly. And so this
Oh,
situation where her body finally got into this restorative sleep, and it was finally starting to heal itself. We were getting rid of all this inflammatory responses coming from the fight and flight response, because she wasn't breathing well at night, and she was having significant sleep apnea. And as a result, her body started healing, and she doctor no longer prescribes blood pressure medication for her, no longer prescribes metformin for her diabetes. And here she is now. What's really cool is she has more energy, and she's not looking, life isn't like isn't in tunnel vision anymore. She now has a broader view. She and her son now play tennis. It's a more enjoyable situation for her. Life is just better. Now, is she totally done with things? No, but man, life is so much better for her.
so much better. And again, it makes perfect sense, right? You have more energy, more vitality, and you feel good as your body's functioning like it should. But what's incredible to me is the body will compensate, right? And so you and I both know people, and maybe even some of the listeners, you guys have experienced, or somebody, it can be off and your body just compensates, and you just learn to deal with it. And so you're just going along, and you're just like, okay, we're gonna get through this, going on. And you and I are both saying, no, man, it shouldn't feel like that. Like, that should not be the experience you're having, because we both like you get it. Like, if you get sleep interrupted or things aren't working right, of course we're going to be irritable. Like, it's
Yeah,
hard to be jovial, happy, and high energy and vitality and fully engaged, like really present, because you're just like, oh man, I'm just trying to get through the day. I'm just trying to get through the week. And these little shifts can bring back the natural feeling of energy and vitality that we all should be having.
absolutely. And what's interesting too is she also said that her relationship with her husband improved as well. So this is not something we promise our patients, hey, your marriage is going to get
Yeah.
better. But what happens is, when you sleep and you can actually think and function and you can heal, then all of a sudden you're able to just be happier. And so, yeah, so she's seen improvements with her marriage, she's seen improvements with her health, and her quality of life is drastically improved. And it's all ultimately comes to one going high upstream and treating the blockage of her breathing that then was having these other side effects. But unfortunately, that happens way too frequently that we don't ever look at what the cause is. We just are treating the symptoms.
Yes. And
Yeah.
how, man, it just makes me think here, Tom. I'm sitting here thinking like how many of us, without even knowing it, are
Yes.
living below like the potential wellness we could be experiencing across the whole spectrum. I love her story because it's the whole thing. It's anything from relationships to a menstrual cycle, like the whole spectrum. Like where we've learned to compensate or think, well, this is just the way it is for me. This is my life experience. You're like, man, if you can just adjust this little piece here, then
Yes.
then you go way upstream and then way back downstream. Now all the benefits that
It's
come
huge.
out so much better.
It's so huge. And this, it's interesting, right? I mean, I wish if in an ideal world where we should be looking to treat the patients at the very, very beginning is probably about our infants that are 2 weeks old. That's probably where we should be looking. Because what I didn't share with you is that a lot of this is a function of one, not nursing long enough, and two, sometimes we have nursing challenges. And I want to share, I feel so bad because I feel like there's a lot of mothers out there that have this guilt because they weren't able to nurse their children like they wanted to.
Mm-hmm.
But there are physical things that could be interfering. Lip ties can interfere with a good latch, and a tongue tie, not to the tip of the tongue, but even a little bit further back, can affect the way that the tongue's able to swallow. So that leads to colickiness and weight loss. And then, you don't want to see your child in the 10 percentile. And so all of a sudden you switch to bottle feeding, and that
Mm-hmm.
changes how you swallow. And that swallowing then creates this narrowing of the jaw that then contributes to what we're talking about in our teenagers and our adults.
So
So
so much of this starts with nursing.
yes. And the challenge is I have heard from some lactation consultants that their hands are tied, that they can't talk to the client about a tongue tie or a lip tie, but they look at they try to work around it simply because maybe their medical system doesn't treat tongue ties and lip ties. And so it's just really sad. I feel like that's an area of a blind side that we in the Western developed countries were missing. Whereas there's a lot of societies culturally that they realize that babies won't thrive unless they do a tongue tie release or a lip release. You look at these babies in Africa and the Amazon, and they have these big broad jaws, but their midwives are really quick to, if they see that, they will initiate a release really, really
Yeah.
quick. So it's interesting, right?
And it
Just
plays out for decades
yes. And
on the
sometimes even
development of the jaw.
it goes under the radar, right? Some people might be doing just fine, but then for guys right around the age of 40, our muscles, our hormone starts changing. That affects our muscle tone. And then all of a sudden now we get sleep apnea, where we've had our hormones were protecting our airway all these years. And women right around 45, 50, 55 in the menopause area, that's another time when we really need to be very, very mindful of what type of breathing are we doing, and get evaluated.
This is so
Yeah.
amazing. Oh, it's so amazing. I wanted to go back. You've mentioned healing multiple times, um,
Yes.
especially during sleep. And most of us think, well, healing, oh, were there injuries? Were they in an accident? What's going on? But I think you're referring to a different type of healing that happens in good sleep. Will you expound on that a little bit?
Sure. Yeah. So restorative sleep is a scenario, right, where our body, just from the stresses of the day, if you work out, if you're exerting yourself, there's certain muscles that get they get fatigued. And so this is a situation, if we are not getting this restorative sleep, and we are not letting those muscles, those our heart heal. So we have to give our heart a chance to take a break. In order for our heart to work, is it's the most efficient pump in the world. But if we run it at 110%, 24 hours a day, we can run into problems. And so what they found is there's a link between atrial fibrillation, so heart arrhythmia, just a rhythm being off, that then can cause other problems with the heart, and obstructive sleep apnea. So over 50% of people that have atrial fibrillation should also have sleep apnea. And so
Ooh.
so to your listeners out there that might have a mother or father that's taking these medications, one of the questions we should ask their cardiologist is, have you ordered a sleep study
Hmm.
to evaluate to see, is that also contributing to it? Because what we do know is that there's a procedure that's done, is called cardioversion, when the heart rate is off, and they go in and they basically kind of try to get the heart back into better rhythm. And they found that if they can treat the sleep apnea and their breathing, it will stay in rhythm. If they don't, it will go back out of rhythm again at a very high rate, like 78%. So it's super high.
Wow.
So it's just one of those things that we really need to start looking at what the core elements are, and still do those procedures of the cardioversion. We need to get the heart in good rhythm, but let's also address these outliers that are causing these arrhythmias, and not
Right.
just treating the source. Or, I mean,
Yeah.
just treating the symptom, not the source.
Right. And this just makes me like think about, I don't know if it's possible to emphasize enough how all the systems in the body are so what interconnected, right? Every system from the heart to blood flow to the nerves to any level of inflammation, and of course the brain, it's all operating together. And all you have to do is just get a little inefficiency in breathing, a little interruption in sleep, and then it starts trickling again to these other systems.
It's so true. And one of the systems that a lot of times we totally ignore as well is our urinary tract, right? So a lot of there was a patient that came in, a female in her 70s, that was getting up 7 times at night to go to the bathroom,
Wow.
right? And so, and who would have thought that that's breathing related? So when we addressed her, we tested her and we found out that she had obstructive sleep apnea. We then made a mouthpiece for her. And now that 7 times came down to one, and sometimes none, where she'll sleep almost the whole night
Amazing.
through. And so once you start getting that complete sleep, you don't get that fragmented sleep, that's when quality of life returns, and you have energy, you have the ability to enjoy your grandkids and go on that walk with your friends and go out to lunch, and you get out of survival mode and you start enjoying life more. And that's what's really so enjoyable about what I do, is I get a chance to, yeah, I'm a dentist, so I help people with their teeth, but I really love helping see people's lives and families improve. Because, if you help a child that is struggling with school and attention deficit syndrome at school, and then they come in 6 months later saying, hey, they bring in the report card and say, hey, I just got A's in my class, I'm doing better. And then mom and dad are doing better, you have less disruptions, it just affects the whole family. So it's really one of the most rewarding things I do in dentistry. And it all started right from, from, it's just this crazy situation where we saw these different events occurring when people were sleeping, when I was doing their dental work when they were sleeping. It's
That's
kind of a massive
so awesome. It's
um,
so awesome. Okay,
rabbit
so
hole.
let's dive into then what you're doing. What do you recommend? How do you help people? One, how can we test it? Two, like what can we do to start breathing more through our nose? And then I guess three or maybe more, the mouthpieces, the harder, like what can we do to all dramatically start? And I think I'd love to hear your thoughts on this too. I think everyone should do this. it's not like, well, I don't have any problems, so I'm good to go. Like, no, man. Like, I keep thinking about it. It's like, what other potentials do I have? Because
Yeah,
I'm healthy and strong, and energized, but I'm like, man, I breathe through my mouth a ton. Let's
yeah.
cut this back.
Well, I think let's talk about what the or the traditional approach is. The traditional person that they're looking for with sleep apnea is somebody that's overweight, somebody that has diabetes, that has a heart condition, and at that point, then they're looking to see, do they have sleep apnea or not. But what I have found is I have a lot of really skinny athletic patients that have sleep apnea, and it's because they have narrow jaws. Um, Years ago, there was a technique in the orthodontic world that would extract teeth and then basically shrink the size of the mouth, and that smaller square footage inside the mouth left little room for the tongue, and the tongue would fall back and block the airway. And so what I also see is I see a high correlation between patients that have had those four bicuspids removed for a cosmetic procedure that now leading to more health challenges. So
Hmm.
one of those things where we look. So if your listeners are considering orthodontics and they're talking about taking teeth out, I would highly recommend that they don't and get a second opinion. Um, if your listeners are waking up fatigued and tired, I would highly recommend doing an evaluation, doing a sleep study. And there's sleep studies that you can do at your own home. So you aren't going to a foreign place. You are sleeping in your own bed. They're fairly non-invasive, and it's really, if and we can do a sleep study for a few nights, not just one night. We can do it for 2 or 3 nights, so we can average and really see what's happening, rather than just taking one night. That could be a good night or it could be a bad night, and maybe we're really missing what's going on.
And is that
Um,
true for kids too? Let's say you've got a child who maybe this particular child he's just struggling, or she's just struggling. Like there's some behavioral stuff. Like, is that, it seems like one of the first places to look.
Absolutely. If you notice your child is mouth breathing when they're sleeping at night, if you notice they're not breathing through their nose, if they're tossing and turning, they have messy sheets, if they're a messy sleeper, if they're having accidents at night, those are all signs of sleep apnea and airway blockage. And so who would have thought bedwetting and inability to focus at school is related to breathing? But the reality is that it is. And so we can help with those different things as we help them breathing better, and they're sleeping better, and they're able to work through those areas as we're growing the job bigger and help them develop that.
Amazing. Okay, so how? So
So
how do we do
so
a
how,
test?
so how do we do it? So yeah, so I am a part of it. So I'm gonna make a recommendation to be a Vivos provider. Um, you go through a lot of training, and so not every dentist is trained to do what I'm sharing. And so maybe less than 1% of dentists are trained to do this in the United States and the world. And so I would recommend that you seek out one of those dentists. And if your dentist is a fantastic dentist and wants to learn, maybe recommend that they get trained in coming to the Vivos Institute, and they can then become trained, because there's a lot. Unfortunately, there's not enough of us that are trained to treat all the people out there. So it's estimated that a third of all adults have, a third to 50% of adults have either upper airway resistance or obstructive sleep apnea. So that is a high number of
That's
adults.
huge.
And as our population, as we are battling this obesity epidemic, um, that is only going to go up. So we really need to treat the source of what's going on. So I would find a good, I'm also in dentistry, we don't have a specialty in sleep. We don't have, you have sleep specialists in the medical world. In dentistry, what we have are diplomates that have done additional training in sleep. So I'm a diplomate of the American Breathing and Sleeping Academy. So and there's also so you want to find somebody that's been trained, that's passed these exams and know what they're doing, so that they're going to help you find the solutions that you need. So you want to find somebody that's qualified. And so that's the first step. You want to get a sleep study, and we can do sleep studies on children. We can do them on adults. Um, if when we get to yeah, and a lot of these can be done at your own home. Um, there's a new technology that's utilizes these special sleep studies that that are very non-invasive, and most Vivos providers have access to those. So it's just, once again, it's a great resource, or they're pulling in all these great technologies to help with that.
Very
Um,
cool.
the second thing is that we have to start retraining the tongue. If we are The tongue is a most powerful tool, powerful muscle, and it's an amazing tool for shaping the jaw. So if we grow the jaw bigger and wider, but we don't address the tongue and how we swallow and how that reinforces and goes into the right spot, it can work against us. So we really want to make sure and so we work with different myofunctional therapists. These are like physical therapists that are trained. Some of them are speech therapists that have additional training in the proper swallowing and breathing. And so we work heavily with myofunctional therapists. And some of these are hygienists that have been trained in this myofunctional therapy. So it's really a specialty niche. And they are fantastic to help us retraining the tongue and breathing.
This is incredible.
And
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 then,
then and then the hardware
yeah, there
is
we go. That's all. This is
where
fascinating.
that's really right now the best way to do it is through one of these Vivos providers, or people that have been trained in dental sleep medicine, that have been boarded and certified. So that way they can really help identify what's going on. And we work with great sleep doctors. We have the diagnosis comes from our medical colleagues. I work with some phenomenal sleep doctors, as well as I work with some phenomenal physicians that can recognize this in their patients. And they realize, hey, they tried a CPAP, they're intolerant to it, they can't use it. Let's now treat the source, and they refer them to us, and we work with them.
So
So
cool.
yeah, I'm really fortunate. I've got a great network of doctors that I work with that refer their patients. And
And then ultimately it's a mouthpiece that is helping expand the jaw, right? If I understand that right?
that's the best way to do it. Yeah. So we have two choices. We can either do a passive mouthpiece that just holds the jaw open, you can breathe better. But what we found is that apneas, even when you're treating the apnea, when you treat apnea with that and also with a CPAP, we understand that sleep apnea will get worse over time. So unless we change the variable of increasing the pipe that we are breathing through, our sleep apnea over time, our muscles, our tissues are going to be more collapsible over time, and our apnea will get worse, and our risk for heart attack and stroke significantly go up. So those are the things we really are trying to battle. And so if we can actively help to grow the jaw bigger and wider, as we are also artificially hoping the airway open, so you get immediate response, that you can breathe better, then we find that over time we start re-engaging nasal breathing. So for me, I personally have been treated with this. So my whole life, when I was really young, my mom said I nearly died in the hospital because I had a respiratory issue.
Mm.
And I was able to pull through. They weren't sure I was going to make it, but I made it through. But my whole life I was congested. I never could breathe effectively through my nose. We always attributed it to allergies, and I took different allergy medication. I was told I had exercise-induced asthma. I would wheeze when I would exercise, and I love sports. Football and basketball and track and every sport imaginable. I had a lot of energy, and I'm sure I was like a lot of those kids that my mom felt like I had so much energy. I wasn't sleeping well at night. I had so much energy that I was bouncing off the wall. So let's focus that into sports. And so that's kind of what I ended up doing. And so it wasn't until later on that I look back, I see all these different warning signs that, of course, the technology wasn't available back then, but I could have really benefited from this technology much earlier in life. So I started growing my jaw, and this is in my mid to late 40s. I'm doing this, so I'm growing my jaw wider, and within 3 weeks, one nostril that was always plugged my whole life opens up. I'm like, oh my gosh, this is kind of crazy. Is this kind of a fluke? And I said, okay, well, I keep on wearing the mouthpiece and sleeping better and feeling better. And then 3 months later, the other nostril opened up, and they've stayed open ever since. So that's where the hard tissue that we were talking about helped to open up the airway from a hard tissue standpoint. Now, when I first started this, I didn't fully understand and appreciate the benefit of buteyko breathing techniques and also lip taping. So I probably could have had it open up even sooner with addressing the soft tissue as well. So I think with now when we work with our patients, we're addressing it all at one time. We're working on the soft tissue. We're helping address the really re-engaging nasal breathing the best we can.
Man, this is all so
Sorry,
awesome.
I get so excited about this stuff, and I tend to talk a lot about this,
No,
but
that's exactly why I had you on, brother. Because when you started explaining this stuff to me, it just made so much sense because I get to work with so many great clients and my own experience and working with others. I'm like, yes, that just fits. And these are little puzzle pieces again, because it's a huge picture,
it
right?
is.
The human body and life is just very complex, but it's so often it literally can come down to very simple solutions. And
Yeah,
there's so many things we'll struggle with, sometimes for years or decades. And you stop and say, okay, is it something we're eating? Is it sleep? Is it breathing? Like
yeah,
you look at these pieces first, and sometimes that's it. That's your thing. You have a child or you yourself are struggling with this breathing thing that's actually a sleep thing that then turns into major inefficiencies inside your body. And so your fitness goals or your ability to focus at work or studies, like this is being wrecked because of a little thing. And just there's the solutions right there. Man, I love this stuff.
yeah. It's amazing. I mean, I have to agree with you. I think we need to look at food as medicine, and food is really, if we really need to focus on an anti-inflammatory diet, because
Yes.
really everything I'm sharing with you, we're trying to decrease inflammation.
Yep.
So as we are stopping these inflammatory responses, these fight and flight responses, when you have these airway blockages, we'll see some. I saw this. We did this one test in this one child, and we tested their breathing, and his heart rate got as high as 198 while he was sleeping.
Holy
I'm telling you,
cow.
how is this child? I mean, trying to get your heart rate that high is really hard. But how is that child, if that's what his sleep is like, how is he going to wake up and function normally at school? He's not.
No
He's
way.
just going to be wired, and he has all this inflammatory response. He has his own corticosteroids being built up that creates more inflammation, and just things don't function as well with inflammation. And so what we're finding is that people, as we're helping them with their breathing, they're able to control their diabetes better. They're able to control their other autoimmune conditions better. It doesn't take away the autoimmune condition. We have fibromyalgia is heavily connected with you look at a high percentage of people that have fibromyalgia, a huge percentage of them have a sleep interruptions, and
Mm-hmm.
they have a different sleep cycle than normal.
Right.
People with autism, a lot of these kids and adults have sleep challenges. Now, if we address their sleep, will it help get rid of the autism? Of course not. I'm never going to say that. But we do find that they're able to manage their autism much better and improve their learning, um, and their abilities to function better.
Which
So
makes sense.
it does make sense. So it's just these little things like you're talking about: eating well, sleeping well, exercising. As we exercise, we're able to oxygenate our brains, right? So all these things, we really want to oxygenate our brains breathing through our nose versus breathing through our mouth, right? So it's really critical as we really narrow it down to these small little things, it has an amazing impact in so many different areas, from depression, anxiety, heart attacks prevention, to stroke prevention, um, to ADHD, to just harmony in the home. So it's really amazing just to kind of see all these impacts all come down to one root cause of not breathing well.
and something that every one of us can do better
Oh,
and
yeah.
just be cognizant of. And then, obviously when we're awake, when we're alert, practice breathing through the nose, then we're asleep, get something. Man, I love this stuff. Okay.
Yeah.
Do you want people to reach out to you if they're in California, or they want to go to California, connect with you, or search? I mean, how can, if let's say somebody wanted to be like, look, I want to go, I want to figure this all out. I want to have my family tested. I want to go through this stuff. Do they start searching? Tell us how to get
Yeah. So,
resources.
so if you're in Northern California, if you're, I live in Folsom, California, so in the Sacramento area. Um, I'm happy to help your clients, and but this is one of those situations you want to be near a provider, that because there's a bit of follow up, and
Okay, so it's ongoing treatment.
ongoing treatment. So it's not
Okay.
like I give you a mouthpiece and you're done.
Yep.
There's a lot of follow up, and we want to make sure that everybody is doing well. And so another great resource is going to vivoslife.com. So VIVOS life, LIFE.com, and find a trained provider in your area. I think that would be fantastic as well. And so, but yeah, typically what happens is we like to do a very thorough analysis. We want to understand what's going on, and we analyze the airway in a process called through a head and neck exam. So we take photographs of yourself and your body. What happens is, we talk about the impact is, if you're not breathing well, your head is going to come forward more, and you'll have this more forward head posture to help you breathe better.
I think
And
I
then
have that, man.
and that throws off your shoulders, and that throws off your back and your hips and your knees. And so it's really interesting to start. So we take pictures of the body. And then we also look at your mouth and your teeth. We take three-dimensional scans of your airway. It's called a CBCT. So it's a cone beam CT scan of your upper jaw, your sinuses, your nose, your airway, so we can see what's impacting this. And we really want to understand where those constriction points are. So when we are designing a device, we can design it specifically to address your needs. And we put together a treatment plan, we can be very, very specific to your needs. And
God,
so that then helps us then put a plan together to then uh, create a solution.
I love it. Brother,
Yeah.
this is so cool. Thank you. Thank you for coming on. Thanks for sharing all this.
Oh, I'm happy to be here. We've been longtime friends, and we have these conversations as we're hiking and as we're
Exactly. And then I'm
uh,
like, we gotta share this.
snorkeling.
It's so cool.
But yeah, no, I'm so happy to be here, and I'm grateful that you were able to be flexible with your timing to squeeze me in, because
Oh man. It's like sharing this stuff. It feels like, again, you just, every time we've had this conversation, and then today again, I'm just like, man, these are simple things. I love the upstream. It's the go upstream, look at simple upstream factors, and watch how they play out in so many areas downstream. Really, it does seem unbelievable, and I use that word on purpose. It seems unbelievable how many things are affected by small things upstream that they
and you
seem
know what?
so unrelated.
I totally agree with you. And matter of fact, when I first heard this, I was a diplomat in dental sleep medicine. I had my own sleep lab. I had treated, a lot of patients with sleep apnea. And then I started hearing these other claims of what this can do. I have to tell you, and I talked to my colleagues, and they all thought the same thing. This is way too good to be true.
Right, exactly. It's like the magic pill.
And it's incredible. I mean, it really is. And but it's I have to tell you, I'm seeing this. And as these are anecdotal things I'm sharing with you, but what I want to tell you is I'm seeing major changes taking place in people's lives as they are dedicated to making changes. And it's really remarkable, and it's beyond expectation. it was interesting. I was working with another client, and she was having this, she's just amazing mom, just incredible mom, very busy, but extremely fatigued and tired. And so we started treating her sleep apnea, and she started feeling better. And she was, I shared with her the story of the other patient that her menstrual cycle improved. She's like, what's interesting is I had this hormone related acne on my skin that I couldn't get rid of. And she said, but after doing Vivos and doing these mouthpieces and sleeping with them and breathing better and sleeping better and healing, it went away with me not doing anything. So we'll find, we never promise any of these things, right? Our main focus is getting you breathing better and sleeping better. But what's really fun is to see these other
What comes out of it? Yes.
Other ripples that take place that our patients then report, and we see that, and we're taking pictures and we're documenting these things, but it's really remarkable to see the changes that do take place. And
have you seen any, just I'm curious here, have you seen any improvements in like allergies or illnesses, things like that? Because what you were saying before about breathing through the nose and the it's nitric oxide, right? And the filtering, I mean,
yes,
couldn't that prevent or help with illnesses and allergies?
absolutely. So I'll take me for an example. My whole life I had severe allergies. I was on allergy medications and did everything I could to treat allergies, from homeopathics to every type of Allegra and Claritin and all these other medications to help with allergies. But once I grew my jaw bigger and wider and I could breathe through my nose, I noticed a remarkable decrease in my allergies. So in the back of my yard, we planted these plants for privacy, these big bushes, and they give off this pollen that, as it turns out, I'm highly allergic to. So every time I'd go out there, I would have to take a shower. My eyes would run, my nose would run. I would just I'd start sneezing. I couldn't stop sneezing, and it was just really bad, and particularly during springtime. Well, it was interesting is that after growing my jaw and breathing better, I went out. I'm like, okay, I went out and was working in the yard and breathing through my nose, sweeping up the stuff like I always do. And I noticed a small little running of my nose. Nothing compared to the histamine releases I was getting previously. And I have not had these allergy attacks that I was having every year consistently, in the spring and in fall. And so, so for me personally, I can say I no longer take allergy medication at all. I don't take anything preventively. I'm just breathing better. My nose is filtering, and it's gone away. So from a COVID standpoint, one of the best things we can do is breathe through our nose.
Yep.
I know COVID's changing, but we are coming into cold and flu season. And if we can breathe more through our nose, that nitric oxide can kill the virus. It can kill the bacteria. It can kill the fungal infection that's coming through the air. So if we can keep it away from that perspective, and we wash our hands and be careful of what we touch and touch to our mouth, boy, that's one of the greatest things we can do to help improve our immune system, and keep ourselves healthy and clean. It doesn't necessarily really require all these crazy respirators or anything else. We can just
it's already built in, like the creation like if we can get the body doing what the body was created to do.
Yes,
it's unbelievable.
The nose is no longer a hood ornament. It truly is a functional organ. That's really critical.
Put it back to work. Oh, brother, thank you so much, man. This has been awesome.
Oh, my pleasure.